So first, I would like to ask for your permission to use this video for educational purpose and on internet.
Yes.
Thank you. Now, you had what we call TLIF, open old-fashioned surgery in your lower lumbar spine. When was that surgery?
It was in 2013.
2013. So, and that surgery, can you describe to me first your symptoms before the surgery?
Symptoms before the surgery, I was in chronic pain. I didn't have much of a life. I was living on pain pills and not having any social life or good quality of life.
Yeah, and then you obviously you were diagnosed with the problem of the lower lumbar spine, and I'm going to turn here. You got a one level. This is a one level lumbar fusion, a TLIF, and you got it in 2013. Do you remember that procedure?
Yes, I do.
Okay, so can you just describe to me how was that surgery? How was the recovery?
Coming out of surgery, I was in so much pain. I thought, if this is what having a baby feels like, boy, this is it. Because it was very, very painful coming out. It took a lot of morphine for them to get my pain level back to within a tolerable range. After surgery, I was in so much pain. And
how long did that surgery? How many hours did that surgery take?
I believe it was about 4 hours.
4 hours. And you stayed few days in the hospital, but how long after the surgery were you you could do basic daily activities and so on?
Oh, it was 6 months.
6 months before you could do basic daily activities.
Yeah, it was. I had somebody living with me for a good 5 months.
Yeah, and the way we do that surgery is literally we fillet you open. And I think, we don't want to call name, but you got the surgery in Fargo. I think actually for a TLIF, they did what the TLIF looked like, but the nature of that surgery is that just so invasive, so damaging.
Yes.
And it took you 6 months for you to be able to do basic daily activity. Yeah. How long did it take for you to recover from that surgery?
It was a good year before I felt like I was nearly back to normal, and even longer than that to be back to normal, and I'm still not pain-free to this day.
Yeah. Well, the nature of that surgery is that there are so much collateral damage that sometimes that is just what you describe. Unfortunately, is not unusual, and that is the point that I like to make. That we do that surgery not in 4 hours. We do that surgery in 35 to 45 minutes. Most of our patients after that kind of surgery, actually we have thousands of testimonials, go home within 24 hours. Wow. As a matter of fact, I did 2 of that surgery, 3 level and 4 level. Those patients, I did that surgery yesterday, is not even 24 hours. They're going home now.
Wow.
And then, that surgery even on 3 and 4 levels took us 72 minutes and 90 minutes. And we have 1,000 testimonials, and even we have published paper about that our patients within 2 to 4 weeks are back to their basic previous life, and within just less than 2 months, 3 months are where you needed a year to get after open surgery.
Right.
Because we don't damage too much of those collateral tissues. Okay. So I know you did some research about us, right?
Right.
What did you find out?
Found out that your procedures are less invasive and your success rates are really good with patients. They speak very highly of you.
Yeah, thank you. Now, we are obviously at the beginning of that road with you, but I wanted to start here with this testimonial to just compare the old-fashioned surgery with the way we do the surgery. Well, thank you so much for the testimonials.